The 6th Annual Digital Health Hub Foundation Awards seeks to find the most impactful and disruptive digital health companies. Out of 1,500 submissions, only a select few have become quarter-finalists. Let's learn what their superpower is.
Your surgeon has implemented an acclaimed and leading surgical readiness and recovery program covered by your insurance that uses best-in-class, clinically proven techniques that reduce risk and improve surgical outcomes. This program is now being used nationwide by some of the country's leading surgeons and hospitals, and every patient is being encouraged to enroll and take advantage of it. Joint replacement is a big surgery with lots of complicated instructions to follow. All the steps help make sure you have the best possible outcome and that we make it easy for you. What are the goals of the program? Less pain, lower postoperative inflammation, better wound and tissue healing, better muscle and faster recovery, prevention of muscle damage, better long-term muscle health and function, additional benefits, reduced stress, better sleep, easier communication with your doctor, easier for your doctor to keep an eye on your recovery, real-time access to your nurse to answer your questions. How does it work? A team of nurses and dietitians will be assigned to you to support you on key instructions your surgeon wants you to follow before your surgery and after your surgery. Our clinical care team is an extension of your surgeon's in-office care team. We work together hand in hand. You will receive this information over SMS and an occasional phone or Zoom call. This will include taking nutrition supplements that are designed specifically for surgery, speaking to a dietitian about surgical readiness nutrition goals, following the guidance of your nurse team on key protocols that your surgeon wants you to follow, providing important feedback on things your surgeon wants to keep an eye on, such as pain, wound site, nausea, inflammation, and other health information. You'll receive specialized nutrition supplements designed specifically for total joint surgery. These supplements have been published in leading orthopedic journals and are being used by the top hospitals and surgeons in the country to enhance and accelerate healing. You'll receive dietitian consults and daily support from a nursing team. Think of this program as an upgrade to first class. That's why we call it Upgrade, lifting the aid and support patients receive for major surgery. It's modern medicine at its very best. We estimate that 75% of all patients will have zero incremental out-of-pocket costs. For the remaining 25%, they may have a copay which amounts to roughly $40 per month. We will run a pre-authorization on your insurance benefits and notify you and get your approval before we start your program. Your surgeon is encouraging every patient to enroll. Please enroll today, and we will be in touch after we have checked your benefits. If you have your insurance info, please provide it. If not, we will obtain it from the office. We will not bill your insurance until we have spoken to you and you have approved. Let's upgrade your surgery, reduce your worry, and make it a huge success so you can get back to doing the things you love.
Now, hear in their own words why they should win.
And so MEND is about a much more proactive attitude and approach to healing, taking evidence-based modalities, and addressing some of the lack of care in acute care that is only going to get exacerbated over time given the tremendous pressures healthcare is in. Our clients are health systems, private practices, and what we're really conveying to them is what you do really well is you do this surgery really well, but we know that there's a whole bunch of things in a biopsychosocial model of healing, a number of modalities that are protagonists, a number of modalities that are antagonists that we can bring to bear in a very, very deliberate technology, clinical services, food as medicine driven capability that bolts onto your practice without you having to change your workflows, without you having to install a technology, without really you having to do anything other than partner with MEND and refer your patient to an elevated level of care. We take care of the rest. With MEND, we can provide concierge, white glove capabilities and services to every patient without having to modify anything that the physician does to them. So the Upgrade platform, while we've lifted in orthopedics, and you think about it as a food as medicine core modality with behavioral navigation for our patient, is really a horizontal. It can be lifted into any indication. The actual model, when you think about it conceptually, is a team of clinicians with a set of evidence-based modalities that are there with you all the time to support you through any health-related need. And we can get into prevention strategies in this way, where we're actually indoctrinating people on new sets of behaviors, and those behaviors will stay with them for a long lifetime and prevent some of the things that are causing us challenges at a societal level today. Men's aspiration and mission is to become the world's evidence-based healing company. That's what we want to become recognized. Healing is not just something that happens in acute stage. First of all, it is physical, it's emotional, it's spiritual, it's psychological, and more often than not, intertwined. And healing is something that every human needs, not just now when we have an acute event, but we need it throughout our lives as we break down. So we want to bring evidence-based modalities, and when someone thinks of the word healing, we want them to think about MEND.
Follow their journey as they strive to become a finalist against a very strong field. Join us October 21st for our grand finale at HLTH in Las Vegas to witness the winners crowned.